I've worked for Champaign County Health Consumers for over 11 years. And in the past 5 years, I've seen what I never thought that I would see. And that is many people dying because they were being denied or refused health care, even people with insurance. And I'm tired of seeing the healthcare system failing. I'm tired of having nightmares about clients who we just couldn't help. And I think some people in this room know that we are sometimes referred to as miracle workers. When somebody cannot get health care in this community, they come to Champaign County Healthcare Consumers and the incredible staff and advocates and volunteers. We will move mountains to try to get somebody in there. If we can't get somebody in there for the health care that they need, they would die without us. And we have helped to save some lives. We've gone to extraordinary measures that would make a wonderful, dramatic movie or TV series. We're sort of the ER, like social services, healthcare. And so we're proud of the work that we've done. We should never, ever have to go to those extreme measures. And but we can't always make things work, and we do lose people, and it is very personal. You can't not be haunted by those losses in the sense of loss. There's one woman, probably about my age, maybe a little bit older, last year, who she had been insured. She had a heart attack. Her story was very similar to Ron Akers, who you heard earlier. As a result of her health problems, she lost her job, she lost her health coverage, and she was not able to get the follow-up cardiac care that she was supposed to get following the medical procedure that she had. She came to us because of the medical bills. She wanted us to help her negotiate a fair payment plan with Carl Clinic so that she could resume service. We could see that she was very ill and struggling. We urged her repeatedly to go to the emergency room and that we would help her apply for the charity care program and all that. Just please go to the emergency room. We saw her getting worse and worse. Finally, one day, her husband called and she was really ill, and we begged him to take her to the emergency room. He took her to the emergency room and she died on the operating table. This never should have happened. She haunts my dreams, and there's others. I talked about earlier tonight about a woman just a few blocks away from here with Medicaid who it seems like she was not given proper attention, medical attention, simply because she had Medicaid. I believe if she had had Health Alliance, her asthma would have been diagnosed and treated, and she would have never had to leave her 3 little children behind, including her 2-month-old baby. So I'm tired of those kinds of situations and those kinds of struggles and that kind of sorrow and agony and tragedy that we see. But I'm not too tired to fight. In fact, I'm more and more energized to fight because I know, and we at Healthcare Consumers know, what we are fighting for. This is life or death, and we are going to fight for life. And the other thing is, if people think that they have good health insurance and they're happy with their health insurance, if you look at research and polls about people who are insured and have health insurance, they're happy as long as they haven't really had to use it. Now, when they get truly ill and have to use their health insurance, and you poll those individuals and ask them if they're happy with it and pleased with their coverage, they are not. And that's an important lesson for us to learn. And again, I just want to conclude by saying that I will not shed a single tear if we get rid of the insurance industry. Not one. And so as long as this struggle takes, we're going to be in here, we're going to be in it, because what else are we doing? I'm tired of picking up bodies and trying to rescue people from a death that is not necessary. So thank you all for being here tonight. Thank you so much for listening to us.